Hello, Peter Goertz. I'm a psychiatrist. Let's talk about how bullying affects children and what to do about it. The reason I'm bringing this up is because I do not infrequently see children and teenagers in the emergency rooms where I do consultations virtually. And this past week, I saw a child, and that really was a difficult situation for the child, and that gave me the idea to do this video. So bullying obviously is a form of abuse, can be verbal, can be physical, can be both, can be online, and it can have effects throughout someone's life. I haven't seen this patient for a while, but I had an adult patient in my clinic, and he'd been bullied severely as a child, as far as I recall, physically and verbally, emotionally. And he was still struggling quite a bit from that in his, he was an older adult already. So issues that people can be bullied about are, for example, weight, height, if someone's short, for instance, their skin color, their race, their skin as far as pimples, not having pimples, that can be an issue. Appearance, for girls especially, if they have a big nose, if their breasts, they can be teased about their breasts or bullied about their breasts. Children can be bullied about physical disabilities, mental disabilities, and all that bullying, understandably, can lead to low self-esteem, depression, anxiety, even suicidal thoughts, psychiatric hospitalization, and that's where I see these children and adolescents, teenagers in emergency rooms, and some of them have needed to be hospitalized psychiatrically. And ultimately, the bullying can result in suicide. So, very serious issue. And if someone's abused, that can affect their internal beliefs about themselves. Let's say if a child is ignored by its parents, it might feel worthless. If a child is being sexually abused, it might feel that in order to be a valuable human being, it needs to please others sexually, and down the road, continue that pattern in adulthood even. And bullying can create problems when the person being bullied, the child, for example, internalizes negative opinions. For example, a father might say to a child, "You're worthless, you're never going to amount to anything," and the child then internalizes that belief and doesn't even believe they have the ability to go to college because they feel worthless. And I mean, not that someone has to go to college to be of value as a human being, but just as an example, a child who's told they're worthless may not believe they even have the ability to go to college, and they may kind of give up on achieving things that they might otherwise have achieved. So one basic thing for anybody, all of us to realize and try our best to accept, is that no one's better than the next person. No one's better than you. Very important to try and realize. And if we compare ourselves to others, that can be quite a slippery slope. The comparing in itself is a neutral thing. You can compare apples to oranges, or say he's taller than me, I'm taller than him, etc. I have dark hair, he has blonde hair. All that's neutral. But where the problem potentially can start is if, as a result of comparing, you start having an internal monologue or internal beliefs saying you're of less value because you're shorter or because you haven't achieved this or that, then that becomes a real problem. So if our internal monologue tells us things that essentially amount to self-torture, that is a real problem. So comparing, you want to stop with the comparing. You don't want to indulge in the monologue, internal monologue that essentially can be self-torture. As far as practicalities, if at all possible, it can be helpful to stand up for yourself, or for a child to stand up for itself. Adult, if an adult is being bullied, also, of course, as an adult, stand up for yourself if you're being bullied. A child can stand up for itself if it's possible. So if possible, standing up for oneself can be helpful. Getting help can be very helpful. For example, from friends, teachers, parents. Another thing to realize, like with any abuser, bullies have often been abused themselves. So that can help you get a framework, get an idea where these bullies are coming from, really. They're coming from a place, at least often, of being abused in some way, just like any abuser. And bullies can be cowards. They can be coming from a place of fear, the fear of looking at their own life, looking at themselves, and instead of doing that, they bully and distract themselves from looking at their own life, which can be quite miserable. Thank you.